Hi, I'm Dr. Ashley Izadi from Valley Dental Health, and I'm so excited to be talking to you today about the cutting-edge facial aesthetic treatments that we are offering at Valley Dental Health and how they can benefit your beautiful smile. The body is truly an amazing thing. We have an incredible intrinsic ability to heal ourselves because of growth factors that circulate in our blood. Now, we can use these growth factors to rejuvenate your skin. Let me tell you more. You were in the kitchen chopping cucumbers and you were to cut yourself. It's actually pretty awesome that intrinsically your own body has the amazing ability to heal yourself. Your blood is liquid, and when there's an injury, your liquid blood goes to the site of the injury and a clot starts to form. That's the foundation of your healing and repair. Cells and growth factors get trapped in the clot, and then over the next 21 or so days, you are going to heal by yourself. So yes, we have an amazing ability to heal ourselves, but as you can imagine, certain conditions impact your body and your blood flow, and therefore your ability to heal yourself. The older you get, the worse you get at healing, not better. And this is all due to age-related stiffening of your blood vessels that limit your blood's ability to get to where it needs to go to create a healing response. And it is much worse if you have a disease related to blood flow like diabetes. So where do diabetics have issues? In their extremities like feet. A non-diabetic person can play tennis, develop blisters on their feet, and expect that it would heal. However, a diabetic person, blood vessels are shrinking and blood can't go everywhere it needs to go to create a healing response. If the blood can't get to the site of the injury, the cells and growth factors needed to repair and rejuvenate the injured tissues won't be effective. Small blisters turn into larger blisters and even ulcers. In more advanced cases, infected and non-healing ulcers may even lead to amputation. So how did we discover the power of growth factors in healing? It's actually a really cool story. At the University of Miami, there was a doctor there, and he figured that if blood can't get to the site of the injury through blood vessels, he would draw the blood out and apply it directly to the wound. Sure enough, healing started to happen, and that was a huge breakthrough in medicine. Once we learned that simply applying blood to the area of the injury was effective, the next step was to concentrate out the parts of the blood responsible for healing and apply that to the injury. The centrifuge is a machine that separates the blood into different parts based on the density of the cells and growth factors within the blood. The lighter cells come to the surface and the heavier cells go to the bottom, and basically we would have a tube of blood with 10 milliliters of blood, and we can super concentrate all the regenerative cells into 1 milliliter, which means that if we take out 1 millimeter, it is 10 times more concentrated with the good cells and the growth factors. And when we take that and inject that around the periphery of the wound heals very well and much better than just applying the whole blood. And that technology 20 years ago was named platelet-rich plasma, or PRP. You've probably heard or read about this somewhere, but that's what we've used for a lot of different applications. Kim Kardashian made the technology famous when she posted about getting a vampire facial. But it's also been used as an injection in pro athletes' knees and joints to get them out onto the playing field sooner after an injury. We also mix it with bone graft in dental and orthodontic surgery, and it's used in burn victims and used everywhere, and it's truly awesome. So how did this technology extend into the field of facial aesthetics? Well, because we are, as doctors, we work in this space, and we realize that blood flow is central for you to maintaining tissues in your face, right? You think of yourself as the younger version of yourself, and you can imagine cute cheeks, lots of fat tissue there that keeps your skin supple. As you've aged, blood flow has gone down, and you no longer have vascularity in the area, and you can't maintain that volume anymore because you are not getting enough growth factors to that area to maintain that fat and collagen. So you start to lose volume here, and the rest of your facial tissues start to fall, leading to more pronounced nasolabial fold lines that are forming around the corners and lines around the corners of the mouth, and then of course the gels that are forming here. Everything starts to fall down with gravity due to lack of blood flow. And so doctors focusing on facial aesthetics very creatively said, why don't we just do the same thing and inject these growth factors that promote blood flow back into the areas that have lost blood flow? And of course, once Kim Kardashian started posting about it, it blew up across the entire facial aesthetics industry. A lot of people ask, what is the difference between PRF and PRP? It's really important to understand what these differences are, because once you understand the difference, you would probably never want to do PRP again, because there is no reason to do so. When they started doing this work 20 years ago, you would see a phlebotomist who was the person that would draw your blood. Anyone who's had their blood drawn knows that the first thing a phlebotomist does with a tube of blood is shake it. Why do they need to do that? Well, because in a tube, the blood will clot. So they mix the blood with chemicals in the tube. These chemicals are anticoagulants, so the blood doesn't clot. And once the PRP is made from this blood, it can be used for various applications, but those chemicals that were added in the blood to prevent it from clotting, they're also being injected along with the powerful growth factors. And if you remember, the first step to healing is the blood clot, if you think back to the cucumbers. But if anticoagulants are being injected with the growth factors, that crucial first step is significantly delayed. And if you look at the cucumber kitchen cut example we talked about earlier, if you don't clot, you don't heal. And we know that from the beginning, and we have known that from the beginning, but that was the only option that we had, knowing that when we use PRP, there is that one negative aspect that doesn't allow for full healing. We know we're putting all the good stuff into the knee, but we were also injecting anti-clotting chemicals at the same time, so it really wasn't that good. So what is PRF? PRF is the same as PRP, but with no added chemicals. And how did they achieve this? They removed the chemicals from inside the tube and instead used different materials for the tube itself that either prevent or promote clotting. So now we can take your blood, separate it, draw up the good growth factors with no chemicals, and inject those important cells and growth factors without the additional chemicals. This is the technology that is now being used for orthopedics, to treat professional athletes, and we know they're all getting these amazing benefits without any of the anti-clotting chemicals and negative aspects. And this allows for proper clotting. PRF, or platelet-rich fibrin, has been around for more than 5 years with plenty of research to support its use over the now outdated platelet-rich plasma, or PRP technology. Another aspect of facial rejuvenation that we like to focus on is energy-based devices and lasers. Lasers are truly an amazing thing. The best example I can give you about the impact of lasers is eye surgeons. Ophthalmologists, for example, if you needed cataract surgery many years ago, you would have to have a surgery with a scalpel and a big Band-Aid patch on your eye that's left on for weeks or months while you heal. Nowadays, they use a laser. They know exactly what intensity, power, and pulse to use. That laser energy would go to the exact location and depth, and amazing results with minimal downtime would happen. Safer, better outcomes. You cannot be an eye surgeon in 2024 nowadays and not use a laser, right? The science is there. We know that these energy-based devices are in the future of medicine, in dentistry and facial aesthetics, just like our ophthalmologist colleagues. We also know the exact laser, the exact wavelength to use on different tissues. As the laser beam penetrates into the tissues, the energy stimulates the cells to make more collagen. In aesthetics, we know these lasers are extremely vital in rejuvenating tissue, leading to collagen production. When we combine these lasers with PRF, the laser activates the cells and says, hey, we need you to make more collagen. And the PRF is going to be the building block that is going to help them make more collagen. And in facial aesthetics, when we are looking to rejuvenate facial tissues or prevent premature aging, it's all about the collagen. So now that you know more about the power of PRF in facial aesthetics, I'd love to talk to you more about how facial aesthetic treatments at Valley Dental Health can level up your smile in ways you never thought possible. I look forward to seeing your smile soon.